Hello guys, this is me Dr. Kashan Kasit. Today here we were discussing about the ECG. In previous lecture we have discussed about the ST segment depression. Today we are going to discuss another wave of the ECG complex, which is the T wave, which comes just after the segment we have discussed earlier in a previous lecture, which is the ST segment of the ECG. This T wave of the ECG is the positive deflection after this ST segment, and it is showing the ventricular repolarization. And this T wave, which is showing the ventricular repolarization, is usually seen normally positive in all the leads except some leads which are number 1 here, AVR and V1. Except these two conditions, you will see that this T wave is always above the isoelectric line of the ECG. So usually you will notice that this is the P wave, then QRS complex, then comes the ST segment, and finally here is the topic we are going to discuss today in detail, which is the T wave of the ECG. Now this T wave is normally in a height less than 5 mm in limb leads and 10 mm in chest leads. So it should be less than 5 mm and less than 10 mm in amplitude in both these limb leads and in the chest leads. Next comes here the structure or its shape, which is the smooth rounded shape. This T wave is smooth rounded shape normally, but there are the abnormalities. You will notice here the abnormalities of the T wave involves the inversion of T wave. There are conditions in which you will notice that the T wave will be inverted. Then comes the tall peaked or tented T wave. There can be also a small wave, or there can also be a biphasic T wave. So these are all the abnormalities of the T wave you will notice on a ECG paper of different clinical conditions. So coming towards the first one, which is inverted T wave. So this is the first abnormality of the T wave inversion. So the causes for this T wave inversion, there will be the conditions like myocardial ischemia, or there can be also other conditions in which you will notice that the T wave is inverted. So the causes for this T wave inversion involves, number 1 here is the myocardial ischemia and infarction. Then comes the ventricular hypertrophy with a strain pattern. We have discussed this earlier in a previous lecture also. Then comes the acute pericarditis, bundle branch blocks, and decreased potassium level, which is the hypokalemia. There can also be conditions which are non-specific like smoking, anxiety after a meal, or there can be a condition of pulmonary embolism and head trauma, which is actually increasing the intracranial pressure. So in all these conditions, you will notice that the T wave is inverted. Here you will notice that there are two shapes of this T wave inversion. Number 1 here is the symmetrical T wave, and the second one here is the asymmetrical T wave inversion. So the basic difference between these two is that in symmetrical T wave inversion, you will notice here that the first half or the first arm of this T wave and the second arm, both these are alike, both are same, both are almost same. And this symmetrical T wave inversion is seen usually in a condition like inferior wall MI or lateral wall MI. While this asymmetrical T wave inversion, you will notice here that the first arm is little bit short and the second arm is long. So these two arms or half of the T wave inversions are not alike. These are not same. So that's why these are called the asymmetrical T wave. So asymmetrical T wave inversion will be seen in a condition like hypertrophy, ventricular hypertrophy with a strain pattern. And this is how you will see that the asymmetrical and symmetrical T wave inversions are seen in a different clinical conditions. So now we are going to discuss this myocardial ischemia, infarction and ventricular hypertrophy a little bit in detail, so that you will get your point regarding this T wave inversion. So in order to get a clear view about these conditions, I will describe here number one, that is myocardial ischemia. Then we will discuss the other condition as well to get the clear picture of the T wave inversions in all these conditions. Now we are going to differentiate between these conditions like MI and ventricular hypertrophy. In these conditions, T wave inversions are seen on a ECG paper, but we have to remember some points or some history points of the patient so that you will differentiate between these two conditions like MI and ventricular hypertrophy. Starting from this first one, which is MI. In MI, you will notice definitely the T wave inversion on a ECG paper. Like in inferior wall MI, there will be the T wave inversion. You will see that in the leads 2, 3 and AVF. And also in lateral wall MI, you will notice the T wave inversions in 1, AVL, V5 and V6. Likewise, in condition like anterior wall MI, you will notice the T wave inversion in leads V2 to V6. So in all these conditions, you will notice the T wave inversion, but this T wave inversion will be symmetrical. Symmetrical T wave inversion. So in order to differentiate between the symmetrical and asymmetrical T wave inversions in different clinical conditions like MI and ventricular hypertrophy, you have to remember these points. Then comes the condition like ventricular hypertrophy, in which you will notice ventricular hypertrophy with strain pattern. These are seen in a condition of systemic hypertension. In systemic hypertension, you will notice the T wave inversions in the leads 1, AVL, V5 and V6. These two conditions are same, but you will notice here that the T wave inversions are asymmetrical here. And these are usually seen in left-sided leads on the ECG paper. So this is how you will differentiate between all these clinical conditions. Now we are going to discuss another point here, that in myocardial ischemia, when you will see the patient is coming to you with a complaint of chest pain and you will notice the T wave inversion on a ECG, this does not mean that you will go for directly for myocardial ischemia or conditions like inferior wall MI or any of these, because in a condition like unstable angina, stable angina, STEMI and NSTEMI, all these conditions also show T wave inversions. So how to differentiate between these two or all these conditions? You have to get some history, investigation and also the ECG or serial ECG for all these conditions, so that you will get the clear picture regarding all these conditions. Like in stable angina, the patient comes to you with a chest pain, but when you will get the history, if the pain relieved by taking some rest, then definitely this will be stable angina. Likewise, in unstable angina, you will notice that the patient comes to you with the same complaint of chest pain, but this is not relieved by taking rest, or taking rest will be more than 15 minutes. This will take about 15 minutes. When the chest pain is more than 15 minutes, you will say that the patient is having unstable angina, and in both conditions you will notice the T wave inversions. In unstable angina, when you will go for the biomarkers, that is cardiac biomarkers, that will also be negative. Then comes another condition, which is NSTEMI, non-ST elevated MI. We have discussed this non-ST elevated MI and ST elevated MI in previous lectures also. But here our concern is regarding the T wave inversion. You will see the T wave inversion in NSTEMI also, and the patient will be complaining also about the chest pain, and there will be cardiac biomarker which will be definitely negative in NSTEMI. But when you will see the STEMI in ST elevated MI, you will notice that the T wave inversion will be seen on a serial ECG, and there will be a T wave inversion also with ST elevation in STEMI, and the cardiac biomarkers will also be positive in STEMI, that is ST elevated MR. So all these are the conditions in which you have seen that there is a T wave inversion, but this does not mean that the patient is having unstable angina or stable angina or myocardial ischemia. So there are differences. There should be history taking, proper history taking, investigation and serial ECGs. This will give you the clear picture of the conditions like unstable angina or any of these conditions. Hope you will get my point here regarding all the conditions of T wave inversion. Now we are going to discuss about the tall tented T waves. Until now we have discussed about what is T wave, what is the normal height or amplitude of this T wave, what are the abnormalities of this T wave. Then we have discussed the causes of the T wave inversion, which is the first abnormality, and then there is the differences we have discussed like asymmetrical and symmetrical T wave. We have discussed all these conditions. In the next video we will be discussing the other abnormalities of T wave like tall tented T wave, small T wave or biphasic T wave. But before going to end my video, I must say here, please do subscribe and share my channel and stay in touch with me so that you will be notified for next videos. Hope you like my video. Thank you very much for watching. I'll see you in my next video.